directly or back through the pharmacist once he or she has been educated as to the importance of the background. It's difficult anticipating what information and how much you need to adequately answer the question. It is possible to collect too little information initially and not realize it until you start doing the research. Fortunately, in most cases, it's easy to contact the requester and obtain additional information later. Another technique is to bait and hook by providing a partial response, the bait, based on the initial background. This may generate more questions from the requester and provide the opportunity to obtain additional background information for a more complete response, the hook. There is a risk that a requester may run with only the partial response, which could result in an incomplete resolution to the problem or at worst jeopardize patient safety or therapy. For that reason, this technique is seldom used. Ideally, the background questioning between a requester and a responder should be an open dialogue with a sequence and wording of questions dependent upon the flow of the conversation. Rarely should it follow an interrogation style of forcibly demanding information, especially when you're interacting with your peers. Other points to keep in mind include: show genuine interest. This can make the requester more receptive to questioning. Use open-ended questions. They are often more efficient at retrieving information and promote an open dialogue. Try, "How did you manage your headache?" rather than, "Does your headache respond to aspirin?" Concentrate on the information being provided. This may be difficult, especially when you are writing down the information and also thinking of what other relevant questions to ask. On the other hand, it may avoid the embarrassment of repeating questions. As previously mentioned, show empathy. And lastly, clarify any information that isn't understood. You could also at this point ask how urgent the request is. The level of detail in a response will be partly dependent upon how much time you have to research the subject matter. Continuing on with a systematic approach, the next step is to determine and categorize the question. Determining the question often requires that it be reformulated using the PICO approach. Obtaining a clear clinical question from a problem or ambiguous situation is important because it not only guides the categorization of the question, but also the subsequent strategy you use to search for the best information to answer it. This approach may not apply to all questions. Looking at it more carefully, P stands for patient or population. This describes the patient, age, sex, race, and medical condition. I is for intervention or exposure. This would include treatment, diagnostic procedure, or exposure. C is for comparison, none, placebo, or other. O is for outcome or observation. What is the clinical effect, mortality, or hospitalization? Determining the question using PICO is especially useful for doing Medline searches, which you will get a chance to practice during your time at DPIC. At the bottom of this slide is the URL for how you search PICO. It will actually search PubMed. It is not clear of exact search strategy. Categorization is useful not only for developing a search strategy by indicating which resources may be most appropriate to select, but also for determining the need for future resources in specific categories that generate many questions. For example, a hospital pharmacy drug information library may put more emphasis on textbooks dealing with compatibility issues because of the number of questions they receive involving parenteral therapy, whereas a community pharmacy may choose to have more references on herbals and pharmacology because of the number of questions from patients taking supplemental herbs. Some of the less obvious categories include dosage and route. Example, what dose of doxycycline is used for malaria prophylaxis? Identification. Example, could you identify an orange tablet, round, convex, film-coated, with Novo on one side and 100 on the other? Availability. Example, is Cryptaz nitazoxanide, used for intestinal parasites, available in Canada? Compatibility. For example, intravenous drug compatibility. Kinetics. Rare, most kinetic questions usually end up being therapeutic questions. Example, adjusting a phenytoin dosage based on low phenytoin levels. Pharmaceutics. Example, do you have a formulation for propranolol liquid? Ingredients. Example, which of the following oral antihistamines do not contain starch, lactose, or tartrazine? Toxicity. Many of the toxicity questions are handled by poison control. However, recently I responded to a question where an adult dosage of famciclovir was used in a child for 24 hours. The physician wanted to know if this is toxic, or what adverse drug reactions he may expect. Herbal. Example, numerous herbal questions on the drug phones. Which herbal preparations are of concern during anesthesia? Referred. This may be a question out of our area of expertise. Example, which foods should be avoided when on a cardiac diet? This would be referred to dial a dietitian. Next, you need to develop a strategy and conduct a search of various resources. As previously mentioned, developing a search strategy requires a question and a category to begin the process of selecting appropriate resources. Once resources have been selected, they can be prioritized based on the likelihood of containing the requested information. They may also be utilized in order of availability and ease of use. In other words, organize the search beforehand, knowing where and how to look for the information. You can map their search process and avoid duplication of work by tracking which resources were useful and which were not. If no information is found from the selected resources, then the strategy may need to be reassessed and adjusted to give better results. A search strategy should also account for how much time is available before a response is required. Generally, but not always, the more time there is, the more opportunity there is to conduct a detailed search. A systematic search of drug information resources usually starts with general sources and progresses to more specific sources. How far you go depends upon what is found and the nature of the request. Tertiary literature can be considered general sources as they provide rapid access to information and familiarize the reader with the topic. Secondary resources should be used when a topic is so new that it is unlikely to be covered in tertiary resources, or when newly published information will augment the information presented in textbooks. Primary literature represents the most specific, in-depth, and current information. Occasionally, drug information questions cannot be answered by using tertiary, secondary, or primary resources. In such cases, other sources of drug information may be used. Tertiary sources contain information about a topic that has been compiled from primary literature. They include textbooks, compendia such as the CPS, review articles in biomedical journals, evidence-based clinical guidelines. These documents provide a concise summary of the current best evidence available for demonstrating the effectiveness of a specific healthcare intervention or treatment. If you consider how long it takes to publish a textbook, the goal of these clinical guidelines is to decrease the time it takes to put evidence into practice. Computer databases such as DrugDex, PoisonDex, and handheld applications such as Hippocrates and Apothecarium, and most of the literature found on the internet is considered to be tertiary. Secondary resources include indexing and abstracting services that provide a means of efficiently searching the vast amounts of primary, tertiary, or other cited literature sources. They come in both printed publications and electronic format, with the latter being preferable for ease of use and providing a greater variety of indexed terms. Some include International Pharmacy Abstracts, or IPA, InPharma, Medline, Embase. Use of more than one secondary resource allows for a more thorough information retrieval, as each covers different biomedical journals, meeting abstracts,